Hey everybody, it's Dr. Trey with the Trans Trainer, where I provide physical therapy, post-op programming, and fitness coaching to other queer and trans folks. Today, I wanted to talk a little bit more about some strategies to help reduce bladder spasms during and after catheterization. For example, after a surgery like phalloplasty or metoidioplasty. So there's a couple things that we can keep in mind. One is when the catheter is in place, the less movement of that catheter tube, the less irritation it's going to cause to your bladder. So what I found that works really well is taking a piece of kinesio tape, KT tape, and tacking that bladder tube down an inch or two to the side of where it inserts into your pubic area really helps. So that's one strategy, is to decrease that movement so that when you are walking, when you are squatting, that tube's not moving in and out. The second thing that your surgeon probably told you about already is there is some medications that you can get over the counter at pharmacies that do help with bladder spasms. One in particular is Azo. It's funny because it turns your urine like highlighter orange and yellow, but it does help kind of numb the bladder and decrease the spasticity of it. However, it's not something that we want to use long term because our bladder is supposed to have muscle tone. We want those muscles to get back to full function. So short term, it's okay, but long term, we need other options. So the other thing I've learned recently through a pelvic health course I was taking is that the bladder is really sensitive to certain foods and beverages that we have. It's really sensitive to pH. It prefers a more basic pH. So if we think back to chemistry, it likes a more alkaline area as opposed to really acidic. So foods and drinks that we have, for example, really spicy foods high in acidity like citrus fruits, citrus juices, think like salsas and tomatoes and stuff like that, that can irritate the bladder. Coffee, alcohol, anything else with caffeine in it, like an energy drink. Those are all things that can really irritate the bladder. Now, by no means am I saying that the rest of your life you can't have coffee. That's not going to fly with me. But short term, the catheter is already irritating the bladder. So what you can do is decrease some of those substances short term, and then long term, you'll be able to add them back in as the bladder calms down. The other thing that you can do with this is do something called a water sandwich. So it sounds funny, but what you can do is, so I'm a coffee drinker in the morning. There's not going to be much that's going to stop me from having a cup of coffee, right? But instead of getting up and immediately having a cup of coffee on an empty stomach and empty bladder, where that caffeine and that acidity is directly impacting the bladder, we can cushion it like bread in a sandwich. So what we can do is drink a half a cup of water, then have maybe a half a cup of coffee, and then have another half a cup of water. So we're sandwiching that coffee, surrounding it in something basic with water, and that can help decrease the impact it has on the bladder. So I hope these things are useful for y'all. And as always, if you have questions or concerns or requests for future videos as a trans physical therapist who's been there, let me know and I'd be happy to help.